Welcome to Clinical Capsules from TRC Healthcare, your go-to podcast for fast, evidence-based insights. On this episode, Associate Editor and Clinical Pharmacist Vickie Danaher shares practical strategies for preventing RSV, including recommendations for vaccines and monoclonal antibodies, guidance for pregnant patients, and more in an excerpt from our popular Pharmacy Essential Updates webinar series. TRC has been a trusted resource for healthcare professionals for over 40 years. And now we're bringing that expertise straight to your ears every second and fourth Tuesday in bite-sized, actionable episodes, right here on Clinical Capsules. This podcast offers continuing education credit for pharmacists and pharmacy technicians. Please log into your Pharmacist Letter or Pharmacy Technician's Letter account and look for the title of this podcast in the list of available CE courses. None of the speakers have anything to disclose. With that, let's get started.
We're talking about this today because we as pharmacists and pharmacy technicians play a key role in ensuring patients are educated about RSV, its associated risks, and its preventative strategies, including immunization. We'll need to be ready to effectively engage with patients about RSV prevention, as well as recommend and administer RSV vaccines that are now available for certain populations. There's also been some recent changes regarding who RSV immunizations are recommended for, as well as changes to the RSV products themselves, including a new monoclonal antibody for infants. But before we delve into all that, let's start with the basics and discuss what respiratory syncytial virus is and why it's a big deal. And this will help give us some talking points that we can share with patients about why preventative strategies against RSV may be needed. So we can educate that RSV is a common virus that's usually spread through respiratory droplets, such as when someone coughs or sneezes, or by touching the surfaces contaminated with the virus, and then touching the eyes, nose, or mouth. RSV typically circulates from October through March, and it's possible to get infected multiple times. Now, generally, RSV causes mild cold-like symptoms like runny nose and congestion, but it may also cause serious or even life-threatening lower respiratory tract infections, especially in infants and older adults. In fact, RSV is the most common cause of hospitalizations in infants. And older adults who get very sick from RSV may need to be hospitalized and have a high risk of complications such as intubation. And just to give you a more specific idea of the burden of RSV infection, CDC estimates that for 2024-2025 alone, there were up to 6.5 million outpatient visits due to RSV, up to 350,000 RSV-related hospitalizations, and up to 23,000 RSV-related deaths. So to help prevent the spread of RSV, we can continue to remind patients to practice good hygiene, such as covering coughs and sneezes and washing or sanitizing hands often. But we also want to emphasize the importance of RSV immunization. And to protect against RSV, there are two different types of immunization strategies, either vaccines or monoclonal antibodies. So let's talk about the vaccines at a high level first. There are currently 3 RSV vaccines that we can administer in our pharmacies: Abrysvo, Arexvy, or Mrezvia. And these vaccines are used in older adults or given to pregnant patients to prevent RSV in the newborn. These vaccines provide active immunity. They stimulate the body's immune response against RSV, so the patient's immune system produces antibodies, and it usually takes about several weeks to build immunity. On the other hand, the monoclonal antibodies are nirsevimab or Beyfortus and clesrovimab or Influenza. And these are given to infants and high-risk children. Monoclonal antibodies provide direct, immediate protection against RSV since they're pre-made antibodies. And they're considered passive immunizations, not vaccines, as they don't activate the body's own immune response. We're going to talk much more in depth about these products later, but now that we have this background, let's dig deeper into which patient should be vaccinated against RSV. And to get us thinking about that, we have a patient case. So our patients today are Howard and Linda, who are just picking up some routine prescriptions at your pharmacy. They tell you that some of their friends were talking about RSV vaccines and they want to know if they need one. So, what do you say to Howard and Linda? And what would you want to know about each of them to help determine if they should get an RSV vaccine? So, in thinking about RSV vaccines for older adults, we'll need to know things like the patient's age and medical conditions and whether they've had an RSV vaccine before. We want to recommend RSV vaccination for all unvaccinated patients age 75 and older. And that's because our oldest patients are at the highest risk for severe illness from RSV. So, really, when we see a patient 75 years or older, that should be an automatic prompt to start a discussion about RSV vaccination. Another group of patients that should get RSV vaccine are those who are 50 to 74 years old and who have a risk factor or condition that increases the chance of severe RSV. And this is a recent change. Vaccination used to be recommended starting at age 60 for these high risk patients, but now that age has been lowered to 50. So we want to watch out for patients aged 50 to 74 years old who have conditions such as heart disease or kidney disease, lung disease like asthma or COPD, diabetes with organ damage like neuropathy or retinopathy, or who are taking insulin or an SGLT2 inhibitor like dapagliflozin. Those with severe obesity are also at high risk, as well as those who are immunocompromised due to medical conditions or medications. And this group also includes older patients who are frail or residing in a nursing home or long term care facility. All of these patients are recommended for RSV vaccination, again, since they're at the highest risk for severe complications from RSV infection. So, for our pharmacy technicians, one area where you can especially make a big impact is by keeping patient profiles current with medical conditions and medications, since these factors are what's going to help determine if a patient 50 to 74 should get an RSV vaccine. On the other hand, explain that RSV vaccination is not recommended for patients aged 50 to 74 without risk factors, since these patients aren't as likely to benefit. And then thinking about even younger patients, point out that CDC does not yet recommend routine RSV vaccine for adults under age 50, even though two of the RSV vaccines, Abrisvo and Mrezvia, are FDA approved for people age 18 to 49 who are at high risk. The CDC immunization work group say that there's currently insufficient evidence to make a recommendation for these patients and are awaiting additional data to review. So this is something we should expect to hear more on as the evidence emerges. Let's pause here for a minute to revisit our patient case with Howard and Linda. After talking with them more and in reviewing their patient profiles, we learned that both Howard and Linda have never gotten an RSV vaccine before. Howard is 65 and he's otherwise healthy. And then Linda is 75 and she has asthma. So, what should be recommended for each of these patients regarding RSV vaccination? So, again, Howard is age 65. So, for patients aged 50 to 74, we need to check whether there's any risk factors that put him at higher risk of severe RSV complications. So, he's otherwise healthy, he's at a healthy weight, he lives at home, and so forth. So, no, Howard would not be a candidate for RSV vaccine. Moving on to Linda, she's 75 years old. So, based on her age alone, that's a yes, that we do want to recommend RSV vaccine for her. And then on top of that, she does have asthma, which puts her at even higher risk. So, now that we know Linda should get an RSV vaccine, let's discuss the RSV vaccine products and how they stack up. Like I mentioned earlier, there's three vaccines available to protect against RSV: Abrisvo, Arexvy, and Mrezvia. All of these vaccines are FDA approved for adults age 60 or older and younger patients at high risk. And any option is a single zero point 0.5 ml dose administered into the muscle. But the vaccines do work a little differently. Abrisvo and Arexvy are both recombinant subunit vaccines, but Abrisvo is bivalent to optimize protection against RSV-A and RSV-B strains. And Arexvy has an adjuvant added to help induce the immune response. On the other hand, mRESVIA is an mRNA vaccine that teaches the body to make a protein that's found on RSV, which causes the immune system to build antibodies against it for protection. Point out that CDC has no preference for one RSV vaccine over another in older patients. So, for patients aged 50 years and up who are eligible for an RSV vaccine, give a single 0.5 ml IM dose of any product, Abrysvo, Arexvy, or mRESVIA. Keep in mind that RSV vaccine can be given to older adults year-round, but explain the best time to get RSV vaccine is in late summer and early fall, just before RSV usually starts to spread in the community. So, in most areas of the US, this corresponds to vaccination between August and October. Point out that currently only one lifetime dose is recommended, so patients who already received an RSV vaccine previously don't need one again this season. Data suggests that one dose of RSV vaccine provides protection for at least 2 years, and it's too soon to say when or if another dose will be needed. In terms of efficacy, we can educate that for any RSV vaccine, studies show moderate to high efficacy of one dose for preventing RSV associated lower respiratory tract infections. And data from the first season of use of RSV vaccines in 2023-2024 indicate that vaccination with Arexvy or Abrysvo provided protection against hospitalization, critical illness, including ICU admission and death, and emergency department visits among people aged 60 and older. But since mRESVIA was first used during the 2024-2025 season, that real-world effectiveness data are not yet available. In regard to safety, clarify that RSV vaccines aren't live and they can't cause RSV. And overall, most patients tolerate these vaccines well. The side effects are similar to what we usually expect with vaccines, such as fatigue or pain, redness, and swelling where the injection is given. It's also important to be aware that a very small number of cases of Guillain-Barré syndrome have been reported after RSV vaccination. And there's now a warning about this in the labeling for Arexvy and Abrysvo. But explain the risk is rare. For both vaccines, FDA estimates there's about 8 additional cases per 1 million doses given, and the benefits of RSV vaccination still outweigh potential risks. For example, vaccination of 1 million people would prevent thousands more hospitalizations and hundreds more deaths than the small number of Guillain-Barré cases that vaccination might trigger. Anticipate that Medicare Part D and many other payers will cover RSV vaccines for eligible patients, and the cost is pretty similar among all three products, about $300 per dose. Okay, now that we've talked about RSV immunization in older adults, let's discuss the immunization recommendations for protecting babies and infants against RSV. So, for our next patient case, we have Jasmine, who's 30 years old and 34 weeks pregnant with her second child. Jasmine received an RSV vaccine in her last pregnancy when she was about 34 weeks pregnant, and she wants to know if she needs to be vaccinated again to protect this baby. So, what do you think about this? So, like I mentioned earlier, there's two immunization strategies to prevent RSV in infants, and that's either maternal RSV vaccination in pregnancy or an RSV monoclonal antibody for the infant after delivery. In terms of RSV vaccination in pregnancy, advise that Abrysvo is the only RSV vaccine that is FDA approved for use in pregnancy. It's recommended for pregnant patients 32 through 36 weeks gestation, and CDC recommends Abrysvo for seasonal use, usually September through January. Explain that currently only one lifetime dose is recommended due to lack of data. So, patients who get an RSV vaccine during one pregnancy do not need a repeat dose with subsequent pregnancies. However, RSV vaccination during one pregnancy is not expected to protect infants in future pregnancies. Therefore, a patient who is currently pregnant and received RSV vaccine before the current pregnancy should be counseled that their infant should be immunized with an RSV monoclonal antibody for protection against RSV disease after birth. Be aware that most infants will not need both maternal immunization and a monoclonal antibody. So if the mom was vaccinated against RSV this season in the current pregnancy, share that their newborn won't need a monoclonal antibody after delivery. On the other hand, if the mom was unvaccinated against RSV at the time of delivery, or the mom received RSV vaccine but then delivered within 2 weeks after vaccination, or if the mom received RSV vaccine in a previous pregnancy, explain that an RSV monoclonal antibody is recommended for the baby. In this case, recommend a single dose of nirsevimab or clesrovimab, which are given intramuscularly to the baby, usually in the hospital or prescriber office. The dose is given to infants younger than 8 months of age, but preferably within 1 week after birth, to those who are born during or who are entering their first RSV season, again, which is typically October through March. Also, keep in mind that a second dose of nirsevimab may be needed for some infants at 8 to 19 months old who are at increased risk of severe RSV disease during their second RSV season. So, going back to our patient case with Jasmine, point out that since she received an RSV vaccine in her last pregnancy, she is not a candidate for RSV vaccination in this pregnancy. Instead, a monoclonal antibody is recommended for the baby after delivery. All right, now we in the community pharmacy generally won't be stocking or dispensing the RSV monoclonal antibodies, but we definitely will continue to be a prime place for patients to get RSV vaccines. So let's wrap up this topic with some key vaccine nuances to be aware of to limit vaccine errors and other problems. And one key difference we want to take note of is how these products are presented and prepared. For example, Abrysvo and Arexvy both require reconstitution, but they're prepped differently. With Abrysvo this season, we should expect to only get the dual chamber Actovial version that mixes drug and diluent when activated. The vial and diluent syringe kits are being phased out. With Arexvy, each dose consists of 2 vials, the vaccine powder, and an adjuvant suspension that must be reconstituted prior to administration. On the other hand, Mrezvia comes as prefilled syringes and does not require reconstitution. Also remind everyone working in the pharmacy about proper storage. Abrysvo or Arexvy should be stored in the fridge, but Mrezvia must be stored in the freezer. Limit confusion by ideally stocking the fewest vaccine options needed to cover your patient population. For example, consider prioritizing Abrysvo if you serve both pregnant and older adults, since it can be used for both groups of patients. Pay close attention to preparation and stability info. For instance, when thawing Mrezvia, the amount of time required for thawing ranges from 40 to 160 minutes before use, depending on whether it's being thawed in the fridge or at room temperature, as well as the package size. And with Abrysvo or Arexvy, don't reconstitute a dose until it's needed, since it's only good for 4 hours once mixed. And then questions are always bound to come up about vaccine co-administration. So explain that RSV vaccine may be given at the same visit as any other immunizations patients may be getting, such as flu, COVID-19, or Tdap. Okay, so I know this is a lot to try to keep straight, especially with all the other vaccines we're giving and everything else that we're doing in our pharmacies, especially this time of year. So we've got you covered with multiple resources, including our charts on preventing RSV, RSV vaccines, and RSV monoclonal antibodies. These give side-by-side comparisons of all the products used to prevent RSV infection, as well as more details about the recommendations that we talked about today.
We hope you enjoyed and gained practical insights from listening to this episode. Now that you've listened, pharmacists and pharmacy technicians can receive CE credit. Just log into your Pharmacist Letter or Pharmacy Technician's Letter account and look for the title of this podcast in the list of available CE courses. We've linked the resources we mentioned and more on today's topic right in the show notes. Those links will take you straight to our websites, where you'll find even more concise, evidence-based charts, articles, and tools. If you're not yet a subscriber, now's the time. Sign up today to stay ahead with trusted, unbiased insights and continuing education. And as a listener, you can save 10% on a new or upgraded subscription with code CC1025 at checkout. If this episode was helpful, follow Clinical Capsules and leave a quick rating or review. Tell your friends. Spread the word about our show. Thanks for listening. Stay sharp, stay current, and we'll catch you next time on Clinical Capsules.